Chanjoplus is a USSD-enabled mobile application that creates digital identities for children to enable health workers to track what vaccines a child has received, when they received the vaccine, and where they received the vaccine. The platform is accessible through dialing star 304 hash, after which they basically enter their username. So a username can be a phone number or basically a name. So like in this case, the username attached to this health worker is a phone number. And they also have a PIN. So when they enter the username, they enter their PIN in order to access the platform. So after mother has been registered and they come for routine immunization in a hospital, the healthcare worker is able to vaccinate that mother. In case of mothers or children that are not registered, the healthcare worker can be able to register them. The healthcare worker can look at their summaries at the end of the day and also change their account details. So let's say a mother has been registered in a clinic and comes for immunization. So you simply press 1 for vaccinate. So on the vaccinate menu, you can vaccinate, give the vaccinations due at the moment, that is number 1, or you can actually update entries for immunization where a mother comes with the mother-child health booklet. Where there's no health booklet, you'll basically track the mother from the point of registration and point of first immunization. So if you want to vaccinate now, you simply press 1. And then because you use national ID numbers for mothers or caregivers, you enter the national identity card number that is tied to the child, and that creates basically the digital ID for the child. So in this case, you enter the national ID for a parent. For instance, one of the parents you registered was 37. So you can be able to see like this parent has 4 children. You choose the first child or the second child or the third child, depending on which child has been brought to the hospital facility, by pressing, choosing the child. Press 1 on that matter. So if you look at the first child, you are told the details of the first child, the age of the first child, the last vaccine given, most probably. And this was just for demo purposes. So let's say the child needs vaccines for 10 weeks, for instance, or 6 weeks for this matter. So 6 weeks vaccine, simply go to 2. You're able to then choose what vaccines to give, because they should be given all the vaccines here for 6 weeks. You simply select the first vaccine, separate with a comma, select number 2. Okay. Select 2, separate with a comma again, select 3, separate with a comma, and then select the last vaccine, which is number 4. And then send. So it's basically enables you to verify that you want to vaccinate that child using the vaccines given, and then you press 1 to confirm. So like in this case, this child, the system confirmed that this child had already received the vaccine. So there's no point of, we can't double, vaccinate any child. We can't double register the measures to prevent that. But then finally, we have the Chanjoplus platform. So a healthcare worker would come here, just upload and reverse that. And the platform basically able to show you the users you have, the number of registrations you've done per day, the vaccinations you've done per day, and basically notifications and facilities that you have. And it's able to show you the number of infants. For instance, in this facility today, we are having 96 infants registered. We have 10 community health workers who registered them, and we have about 121 community health volunteers. So that's basically all about the Chanjoplus platform. Our main aim is to enable last mile immunization by properly identifying each and every child. We believe for us to be able to achieve the universal health coverage, we cannot leave anyone behind unless we know who everyone is.